Good evening, everyone, and welcome to our third webinar in our GDR free webinar series. It's nice to meet you all. My name's Yana. I'm the events coordinator here at GDR, and tonight we've got Dr. James Tran, our presenter. So James also works here at GDR. In addition to that, he is a practicing dentist in Sydney and the founder of Lumi Dental, located in Melrose Park, New South Wales. James also has a keen interest in all things dental photography. And tonight's webinar will be focusing on the fundamentals and practical applications of dental photography with insights that you can take straight into your practice. So we're very excited to have James here share his expertise with us this evening. So without further ado, I'll hand over to James to begin the session.
Hi, everyone. Thank you, Yana. And good evening to everyone who has given up their evening here to spend a little time just learning a little about photography. It's going to be about a 45-minute chat, and then we'll answer all our questions at the end. So please feel free to pop your questions on that right side chat bar there, and we'll go through all the questions at the very end there. Now, it's hard to tell what kind of people are in the audience today, but we're gonna we were targeting people who who aren't using too much dental photography, or just want to tweak a little bit, or just getting into it. So this presentation is for those people. So hopefully by the end of it, you'll be inspired to take that camera or buy that camera and start taking some photos. So we'll get right into it. A lot of you currently might be just taking a photo with your phone, like or your intraoral camera, which is fine. But you know, when a patient sees you holding that phone with a picture of your newborn, it doesn't look as professional as a big camera. And this is a huge point that I will be reminding you throughout this next few minutes. Reasons why you want to take photos: documentation, protection. Have you ever done a filling on a upper premolar, like a distal, a DO, and then the patient comes back 6 months later saying, that filling you did, it's fallen out, and then it's actually the MO that's fallen out. You're trying to talk to the patient and tell them and argue with them that it was the other filling that you did. Well, if you had a photo, even if it was an intraoral photo with the intraoral camera, that would have helped protect you. So I really like taking photos for those kind of purposes. It's also helped you document your cases and show them off to the world. I like photography because it really shows the finer details in your teeth. You can see the real fine details in the cracks here on the second molar and the first molar. You can see the wear on the amalgam. You can see the streak and the wear on the composites on the DO of that 6. You can see the crack on the premolar. You can see the separation of the amalgam from the tooth on the second premolar. You know, you could see it on a intraoral camera, but it's not as clear. You know, it's not as good. If you took this photo with a phone, it's going to look a bit grainy. Have you noticed that when you tried to do that with the your iPhone? These kind of photos, you see a lot more real estate in the shot, and you might only be talking about this one tooth, but you can also show the other 2 teeth or 3 teeth in the photo and say to the patient, look, you've got a crack on this tooth, but you've also got cracks here and here. Maybe you need to sort these teeth out as well. Maybe you need a crown. Maybe you need to replace these things. I really like that. Another reason why I love photography, you know, it's self-satisfaction to see your work. It's also to help yourself see your preps, and maybe you want to criticize yourself. Maybe I could have prepped this a bit more, remove a bit more of this crack on the molar there. You know, it really makes you a better dentist as well. If you want to get into the education space, photography is essential. How else are you going to communicate the way you do things without photography. This is a recent case I did of a molar extraction. We sectioned the tooth. It was a difficult one, but we got it out. But I could now discuss with people my approach on how to extract teeth. Another reason to do photography, lab communication. You can use polarizers to remove a lot of that flash from the light and give yourself a more accurate shade taking when you're taking, especially anterior, like veneer cases or anterior crown cases. Your lab has a better chance of nailing the color there. Maybe you want to use photos for social media. You've ever gone on Instagram, Facebook, you've seen those nice photos, and then you might see another clinic where it's very obvious they've taken a phone photo. It's all grainy, it's not sharp, it's not, the lighting not as good. If you were a patient, you'd go for the clinic that has the nice photos, wouldn't you? Maybe, but it's one factor. Now, a lot of you might not be doing photos routinely, maybe just for special cases. They did a study here with some dentists. They questioned a lot of dentists who were 10 years out versus those who were, I guess, less than 10 years out. Most dentists who were 10 years out were using DSLR cameras, over 2/3, well, about 2/3. And the rest were doing, and the 1/3 of them were using smartphones. Whereas people who are 5 years lesser out were only 50% penetration using the DSLR versus a camera. Or you can see here, once people who have less than 5 years experience out were using more so a phone, 60%, and when 40% were only using a DSLR camera. So maybe it tells you something, why are more experienced dentists using big professional cameras? This is an example of mouthwatch, and mouthwatch is considered one of the best intraoral dental cameras on the market. Yes, you can see the detail there. But does the patient really notice? Probably not. But you're limited by the view. You can only see one tooth here, maybe half of either tooth or tooth on either side. In order to take a full arch of photos, you have to take multiple photos here, bang, 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 stitch them together, then explain to the patient, this is your back tooth, this is your second back tooth. It's too much explaining. Instead, if you just take one photo of the arch, it'd be so much easier to talk to the patient about things. But of course, if you're on the market, if you're shopping, we've all got mobile phones. We all want to know, can I just buy some good lights for my phone? Well, yes, you can. This is the VPR on the left, top left, and on the bottom left is PhotoMed. These are add-ons to your phone. So you buy these things and you hook up your phone. It's a constant LED light, and these are actual photos from those sources of light, and they are not too bad. I'll tell you what, they're not too bad, to be honest. And some patients are actually impressed. But in the end, it's still a mobile phone, in my opinion anyway. Maybe I'm a purist. Some patients really like it if you've got a huge camera there. I don't know. It's whatever you feel like is good. These devices, when you look them up, VPR always sells out. PhotoMed also is quite low in stock. They're about $1,000 each, I think, around the $1,000 mark. And if you're around the $1,000 mark, you're halfway to buying your own professional setup. So it's not a cheap exercise. I've seen one of my old bosses buy a very cheap AliExpress knockoff version of this, and she stopped using it after 2 or 3 months, and she ended up buying a proper camera. Just then, just a comparison photo, left and right, iPhone with that extra oral light versus a photo I've taken on the right side. Very comparable. Honestly, very comparable. Very, very comparable. So I'm not going to be harping on about, hey, you should buy a camera, but if you're going to get these mobile phone accessories, really make sure you get good lighting, good retraction. So left side, if you use an iPhone, it's cheaper, it's smaller, easier to use. It doesn't look professional. It's not secure. Now we're in Australia, We're not bound by HIPAA compliance, but in the US, they're very strict about where patient data is stored. It needs to be stored on a secure server, unable to be, logged in externally, and unable to be transferred easily to other devices. So, like having your phone there, you essentially need a separate phone, a work phone. So if you buy a separate work phone, plus you buy the setup, you're pretty much on the same par as buying a professional camera setup. It hasn't happened in Australia, but everyone's saying it's going to happen. Eventually, it will happen with the data. Everyone's worried about data security and data integrity, data privacy. People are going to be asking, when are we going to secure the way we take images? So just food for thought. Do not do this. Do not take photos like I did here in my very first or second year out of school, taking these photos. It's not the same. Yeah, and look, I'm just put my finger there to retract the lip and take a photo with the flash. And I try to explain to the patient. They probably understood. They probably got the point across. It's not that professional though. But of course, we are always guided by studies. Professional photos versus smartphone cameras. They put these photos in front of people, and most people couldn't tell the difference between ring flash photos and well lit LED phone photos. We're talking about picture quality. We're not talking about the experience. But we're here for professional camera propaganda. So let's break down what is in a professional level camera. First is the body. You cannot take photos without the following three parts. First, we need the body. The body, ideally mirrorless, which is a bit smaller and lighter, easy to hold. Second thing you need is an external flash, not the inbuilt flash that comes with the body, an external flash, because it's very difficult to see the back teeth without light coming in. So you need this external flash to see everything. Third is your macro lens. Having a macro lens allows you to see a lot more detail of your teeth, of your cracks, a deeper focal length. If you have a normal lens that you get that's included in most bodies, you will not be able to position yourself very well. Ask me how I know. In general, when we talk about mirrorless or DSLR level, Canon, Nikon, and Sony's always the most expensive, whereas Canon and Nikon, they're a little bit cheaper. Modern, I guess the past 1, 2, 3 years, Nikon's slowly getting out of favor because their mirrorless range is quite pricey. Canon is best value and quickest and easiest to use. So I use a Canon. Sony, I would use a Sony if you plan, and you definitely plan to take videos with the same camera. Sony's got very good camera ability to take videos. You can also take very good photos, but it's very expensive and very difficult to use. A lot more buttons. The menus are very convoluted. But you can certainly try. You can certainly try. Don't just go by price. This is just an image of a DSLR versus mirrorless. All you need to know is mirrorless is better. Don't go for DSLR. If you have a camera in your clinic, an old one that's more than a few years old, it's probably a DSLR, big bulky one. There's no need to buy a cheaper DSLR because they're not being serviced anymore. The technology still works, but it's out of date. You're spending good amount of money. Go for something that's a bit more future-proof. When you're looking at bodies for dental only, there's full frame versus crop sensor. Crop sensor is good enough. Crop sensor means you get a smaller picture size-wise, but for dental, you don't need to get a portrait, a wide scope like view of the bloody mountains. You're just getting a picture of someone's mouth. You don't need a full frame for that. A crop sensor is more than enough. So if you're doing, on the other side, if you want to double your camera up for nature photos, things like that, big scenic things, then go for full frame. It's a bit more expensive, a bit more bulky, but I like just having a crop sensor. I'm very happy with it. And those images you've seen so far on my camera, they're all crop sensor. You don't need full frame. There used to be an M50 Canon, which had no custom settings, but you want to get ones that have custom settings, C1, C2, C3, so that all you got to do is set your camera up. You set them up for intraoral photos, save it as C1. Then you tweak your settings for extraoral photos, save it as C2. So whenever someone's mucking around playing with your camera, you can just switch between C1 and C2. You already take that photo. Nice and easy. Yeah, so this is just a close-up view of C1, C2, C3. This is on a R7. This is a full frame camera. They will have 3 settings, whereas the crop sensor cameras only have 2 settings, which is what I have. I'm very happy just having 2 settings. It would be nice. But this is just an example of what you can do with your custom buttons. Some recommendations. Left is what I recommend, and the left camera is what I use personally. It's the Canon R10. It's lighter. It's a bit more expensive, but it's good. It's been my workhorse for the past 2.5 years, I'd say. The camera on the right was the camera I had before. It was the smallest DSLR I could find on the market and the cheapest one I could find on the market. $900, brand new. It did the job as well. It's a bit slower to use, and there's no memory function. I had to, every time I switched between intro or extra, I had to flick between changing the f-stop and changing the ISO and blah, blah, blah. I got used to it, but was it worth saving a few $100? I don't know. I like speed. I like speed and efficiency. But those are my current recommendations. If you're on the team Nikon, or you've been given a Nikon lens, macro lens, certainly go for Nikon Z series for mirrorless. It's a bit more pricey, but certainly, arguably, the image quality of Nikon is slightly better than Canon. Arguably, it depends how you perceive it, but a patient doesn't really notice. On the right side, DSLR. At that price point, you might as well get the R10 Canon. It's pretty pricey, even the DSLR bodies. But if you're a Nikon person through and through, then certainly you can go for a D3500 or D7500. Sony, they only offer the mirrorless. They've only offered these things in mirrorless. So they've always been a bit more pricey since the beginning of time. And Alpha 6700 is good enough. It's around $1,900. You can try and find a second-hand one. Like I said, takes good video. But if you told me which one should I buy, I'm going to tell you it's the Canon R10. My workhorse, my absolute workhorse. It's fantastic. Okay, that's the body. What about macro lens? It must be macro lens. So it should say the word macro on it. If it's Nikon, it might say micro. Don't be fooled by the word micro, but it's actually a macro lens. Same thing with Sony. Look for 1:1 magnification ratio. This gives you a true representation of the scale of the image when you look at it at the lens. When you have a 1:2 ratio or 2:1, it's a bit weird. You might have to stand too close to the patient or too far. And sometimes it's very hard to zoom in. And you go, oh, I don't know, it's a macro lens, but I don't know. But 1:1 ratio is ideal for what you're looking for. A lot of third-party ones don't have 1:1. I don't know why. But all of the native ones from Canon, Nikon will have 1:1 ratio. In terms of length, 105, 100 millimeter, it seems to be standard. This came from the old days when we only had full frame cameras. And full frame cameras, the ideal length was 100 millimeters. You have this big camera, you have a big lens. When they introduced these smaller crop frame sensors, 100 millimeters was too long. They actually designed smaller 60 millimeter lens, which are actually designed for APS-C, and gives you the same amount of image quality. If you put a 100 millimeter lens on an APS-C body, you've got a huge image which is cropped out by the internal sensor of the camera. It's overkill, and it's pardon me, it's not needed. So and having a 60mm lens, it's smaller, it's much more lightweight. You might be able to get away with taking one-handed photos. So my recommendation for Canon is a 60mm lens. It's what I have myself. They don't sell it anymore. Brand new. You have to find a photographer who is selling it. Nikon, go for the 55mm, which is their version of 60mm, I guess. Very hard to find as well, but if you find it, you are gold. Sony, there's a 90mm lens. I think there's a 70mm one as well. Flash, go for external. Yeah, go for native. I'll just go for Canon. You can buy Godox, which is so much cheaper. Godox on the Sony is very good. Godox on the other two brands, questionable. I've heard questionable things. So this is some recommendations if you want to take a photo. We'll skip this. That's if you want to play around, but usually the flash is too bright and you want to just dial it down a little bit. It also saves your battery as well. This is a photo of my actual setup here. I've just disassembled it. I've got the body, I've got the lens from the old days. I've got an adapter for the lens because it's an older style lens, and I've got the ring flash here. Ring flash is what I use for 99% of my photos. For the other photos, I use a twin flash. A twin flash gives you a nicer photo. You can see more detail. You can see the texture of the gum here on the photo. You can see the line angles of the teeth. So this is great for your anterior work, if your composites that you do. You can see where if you need to widen your line angles or narrow it a bit more or adjust it in certain areas. That's what I love the twin flash for. I don't really use it for anything else, honestly, because it's a bit bulkier. And I'm all about speed and efficiency. Twin flash combined with diffusers. So these are the big boxes that you might have seen on Instagram. These soften the light. So the light is not as harsh. And so it gives it a nice like ambience, you would say. It makes it look nicer. The softer the light, the nicer it looks. This is a alternate version that you might have seen from the Dr. Camera Pop. It's a converter. It converts the light and splits it into two beams to mimic a twin flash. Also a very good option as well. It's just very big. Too bulky for me, but it wows the patient. They go, oh my God, look at this huge thing. This is the fixed light. This is one of my patients. There was a time when I used fixed light all the time just to really wow the patient. And I quickly realized it was just too bulky for me to carry between practices. So I stopped using it personally when I go between practices. But it looked really nice, really nice. And compared to a smartphone, you can't really get a good result of a twin flash smartphone versus twin flash DSLR or mirrorless camera. This is what the study says. This is just a quick comparison. You can see twin flash on the left, or twin LED light on the left. Moving to ring flash, which is a bit harsh on the light there because it's a ring. Whereas on the right, it's twin flash with soft boxes to really mellow the light, and you see all that detail there. Nothing's washed out. Really, really nice photo. So that's a summary of the Canon setup that we've talked about there. I like go with native components. I don't like using external, but Godox is probably the most common brand right now. Nikon, same story. Try and go native. I don't think Nikon has a native twin. No, it does. It does have a native twin flash. Sony, Godox and Sony actually teamed up recently to make a twin flash. So if you go for an MF12 Godox twin flash for Sony, they kind of tweaked it to adjust the white balance so the camera photos look a bit more color accurate. When you get your camera, make sure you change your white balance to flash. Or if your camera like images are too red, or then lower your Kelvin here on the settings, especially if you're using diffusers. Just a little hot tip there. Another thing I like to do is, in terms of legal representation, you want to, especially for like aesthetic cases or maybe high risk patients, you want to enable RAW plus JPEG. So RAW images are images that cannot be edited. So if your patient tries to argue with you that you did something wrong, you can show them or the judge the RAW image instead of a JPEG. Because if you show a JPEG image, it could be argued that it was photoshopped or edited, whereas RAW cannot be edited. SD cards, this is pretty standard. Go for as fast as you can. Go for an expensive, quick one. You don't want to waste your time getting a crappy card in case it fails. So these are some settings that I like to have. When we're taking an external photo of a patient, I will switch my f-stop to f11 or f8. This is a full face photo, and I'll rotate my camera 90 degrees so that it's a portrait view. When I'm going close up of just of the lower thirds of the face, I'm going to switch the f-stop to about f14 or f18. When I get even closer into the mouth, I need to see the front of the teeth all the way to the back, which means I have to dial my f-stop to 32 or 22, whatever the maximum level is. The f-stop gives you a bit more depth of view. That's a quick way to remember it. So by doing that though, I still need a flash to flash that off. I also might need to increase my ISO from 100 to 400. It depends. If I use a mirror, the mirror absorbs some of the light if it's a basic standard mirror. So sometimes I adjust the ISO or I will adjust the f-stop here. Take a photo of that because I know it's a lot of numbers, but this is a good starting point, and you just tweak how it fits with your office and your camera. Yeah. But how I like to adjust my photos is I like to just try and change only one setting. So in this case, I like to change just the f-stop rather than trying to change ISO too much or trying to change the shutter speed too much, because we want to keep things as simple as possible. We want an easy life. So extra oral photography, we'll just briefly go over this. This is like if you're doing ortho, you're taking a lot of photos here, frontal, left, right, close-up photos. You know, it's for your own protection because a lot of authors are after you. You know, if you're doing orthodontic cases, if you're doing DSD cases, you want a big smile photo, you want an MR photo, repose. Depending on your teaching, you might do a Duchenne smile, so a very big, wide, extra wide smile, like you'll do a side profile shot. In the old days, you need to take a 12 o'clock shot there. That's the really gruesome looking one on the right side here. But these days, you don't have to do that photo anymore. And you need a photo of a close-up of the teeth so they can marry up the teeth with your STL intraoral scan and also marry up with the 12 o'clock scan or the frontal scan. Modern days, you might have seen things like Smile Cloud. They just need one photo, and then they use AI to animate the photo. Some of you might have seen that. It's a bit creepy, but that's all you need now these days to motivate a patient to say, yeah, okay, I'm interested in learning more about veneers or straightening my teeth. So tips on taking good frontal photos. Make sure you can have a plain background, as plain as possible. You want eyes horizontal, face even halves. You want to see the ears on both sides. If you only see one ear, maybe you're too far to the left or too far to the right. This is very common for people who take photos of patients who are lying down in the chair and hold the camera up here, trying to take an extra oral photo. They usually lean to the left because they're standing next to the patient, not standing right in front of the patient. So please sit your patient up or stand them up in front of a wall. Otherwise, your pictures will be uneven. Big wide smile, even vertical portions. Get that golden ratio. Golden ratio is just a theory. It's not applicable to every single case, but in general, you can try and apply it and make sure this will help with your aesthetic planning. How to get a good portrait photo? It's more just imagining your patient's taking an OPG. That's how I like to think about it. Make sure the line from the forehead to the base of the bottom lip is vertical. Make sure your Frankfurt line is horizontal. Pardon me. Make sure you don't see the other side of the face. So in this case, with my patient here, you want to see quadrant 1 and quadrant 4 teeth. You don't want to see 2-1. You want to see 3-1. If you see it, just rotate the head a bit more. Tuck hair behind ears. Take glasses off as well. That's a very common thing. The glasses can give you a big reflection and affect your color. Just a summary here. I like to take the photo just slightly above horizontal, looking down. What this does is two things. The first, it doesn't reflect the flash straight back to the camera. It reflects the flash down and further down, so it doesn't look as bright. And the second thing it does, it accentuates the smile a bit more. So it gives a more accurate smile line. You can see the bottom lip there is curved. Whereas you might have seen some other photos, or maybe if your patient's lying in the chair and you're trying to do a photo where they're lying in the chair or even sitting up, you'll see the smile lip. You see the lip is like really flat or even like reverse smile because you angled it down up. Don't do that. Make sure they're sitting up, please. There's one tip, do that. Okay, if I go, like again, if I go close up, F16. This is an example of a twin flash with soft boxes. You can see the reflection of the soft boxes here. And I've placed a black retractor behind the teeth. So this top left one or the middle one I've used, what it does, it shows you the incisal edges of the teeth. So if someone's coming in with like a chipped tooth, or you see a chipped tooth and they don't notice it, take one of these photos. That black contrast really shows everything. There's no distraction of the tongue and the throat, and they can see everything in detail there. And you can show the patient, look, you need this, you need this. And with the black background, it's easy for you to draw on it. If you have an iPad, you can say, look, you need this tooth a bit longer, this tooth a bit shorter, this tooth a bit more rounded, a bit more square. No, this is really good for communication. Having that nice black background. It also looks great on Instagram after you crop it. Shade taking photography. A quick tip, if you're not sure where to look at on the shade tab, it's in the middle. So not the incisal part or the gingival part, more like the middle. That's where in this case, the A3 gets its color from. So just in case you didn't know, yeah. If you're using the 3D Master shade guide, start with you can see there's groups here. There's group 1, 2, 3, 4, 5. You pick one group that's closest in color, and in that group, you start with the middle tooth. Then you go which one is more red, more blue, more whatever, and then you pick your final shade. Just as a quick tip there. When you're taking photos of your front teeth before you start to prep them, if you're doing a veneer case, do it as early as you can. So lie the patient down, numb them up. While they're numbing up, it's going to take 5 minutes to numb up. Take those photos, take those shade photos as quick as you can, as early as you can. Turn down the flash because the flash really washes out the color. This is probably the only time I would allow a phone photo to be taken because the phone doesn't have a flash. You could disable flash and it takes the actual color. So just a tip there. Make sure you hold the shade guides edge to edge to the target tooth. If you really want to be advanced about this, you can buy one of these Shofu Gubby shade tabs because it actually gives you a more accurate representation of the color because the pink gum shade absorbs for that light. So when you do a shade guide with this in, it gives you a better result later with the lab. Make sure you have a new shade guide. Some of the older ones get worn down, especially with like alcohol wiping, especially like exposure to light. Ask your lab if they're using a different kind of material, do they prefer a different kind of shade type? Sometimes like things like ivonclad, but like things like Adite, when my lab's using Adite, and they have an Adite specific shade tab, and I had to buy one off them. So make sure you are communicating as close as possible to your lab in terms of what materials they use and if there's any shade guides corresponding to the material they use. Intro photography. This is my, I guess, I can just take a photo of this, talk to the patient. When you're starting to take photos, you want to book extra time. Book like extra like 10 minutes, or if you know there's like a cancellation the next appointment, or if you're extra time, then really take those photos early on in the piece. You know, I like to minimize patient movement. So when the patient's lying down and they're taking the bite wings, while DA is taking the bite wings, while the patient's lying down, I'm going to get the patient hold retracted and I'm taking my set of photos. Saves me a bit of time getting to sit up. Then when they sit up, about to take the OPG, I will sit them up. Before the OPG, I will get them to take the extra oral photos, then send them to OPG. That's my photos done. So we're minimizing extra travel time, seeing the chair up, seeing the patient, seeing the chair down. For new patient examination, you only need an upper, a lower, a frontal, maybe your frontal's teeth separated to see the incisal edges. You don't really need a buckle. If you're taking scans, that's okay. You know, it's not like you're doing an ortho case. If you're doing an ortho case, you want more photos. But bare minimum, this is all you need. So altogether, for your new patient, you just need 8 photos. It should only take you about 1 or 2 minutes at most. Once you and your DA are synced up, 1 or 2 minutes at most. Item codes 072 and 073. Retraction is very important. If you're not retracting and you're just relying on trying to pull the cheek out of the way, which is what a lot of us are guilty of, you're going to get a dark photo. Your flash is going to be blocked out by the lower lip or the upper lip, and you're going to see nothing. And then you end up pulling your lip down with the other finger, and it looks weird. So have a retractor there. Even lip retractors are good. Get that light in. These are different styles of retractors. You've got cheek ones, you've got the metal ones. There's no preference. I like the clear plastic. I like the black ones. Some people argue that the plastic ones can reflect light and distort the image. So they all elect to get a black one or not a metal one. Make sure your lips are out of the way, not covering the gums. Objugate, rub dab. It's a natural retractor. And so you can just get a buckle mirror and take those quadrant photos. So this is just an example of us taking some photos here. Ignore that I'm holding it with a glove. This is a very old video. But you can see teeth together. We've got teeth apart here. We'll take the photo there. Now we're going to do an upper occlusal. He's still just sitting up in this case. You can do it sitting down, sitting up. When sitting up, you got to hold the camera up high. You can blow air to get rid of the fog, or you can use a slow speed suction, or you can preheat the mirror with hot water. Then we'll do the lower. Chin up now? With a lower, we'll get the patient to put the chin up. And we'll take the shots here. The setting is f16 on this one. So I've lowered the f-stop because the mirror absorbs a bit of light there. So I need a bit more light to come through by adjusting the f-stop here. Okay, you can see the photo down on the left. Okay. If the patient's lying down, you can see I'm still holding the camera up here. You know, we'll just, sorry, we're just short on time here. We'll just go for the essential upper and lower. But when the patient's lying down, you need to make sure that you're in a replicatable position. Like in hindsight, I would probably be standing behind the patient rather than standing to the side here. Because I don't know. When I'm standing behind the patient, I know the image positioning will be a bit more predictable. It means I've got to rotate the image a bit more post-op, but I know it's more predictable. So this is the upper photo. I'm saying up above the patient. Yeah. Again, the setting is f16. We'll go to lower here. Patient's lying down. I'm standing in front of the patient to the right of the patient. And I've got to really make sure I'm dead center with the camera. It's quite difficult to set that up. Advanced shade taking, if you're doing crown preps, use a natural dye material shade. That's from Ivoclar. There's not many other products out on the market with that. Cross polarizer, this, like I mentioned earlier, this really eliminates a lot of that flash, gives you a more true color representation of your camera. I don't know if you can replicate this on a phone. I think it's only on like these kind of cameras, these flash ones, and you just get the light in. It's very good for composites as well. So if you're not sure on which shade the tooth is, like if it's A1, A2, on the edge, or if the gingiva is like A3 or A4, you just put a dot of each composite and you take a photo. Take a photo with the flash, I take a photo with the polarizer, and it gives you a much more accurate representation of how you're going to reconstruct that tooth. This is just an example here of a implant I restored, and the lab got the color wrong, so I redid this, and this time really did a shade map here with the shade that I said, look, this part A2, A3, I want to be more orange. This size of edge, I want more translucency on the size of edge there. And I use the a tip, if you've got the other tooth there, I use the other tooth as a reference, and I would mirror the tooth there, so you can see that image there. If your lab supports ELAB protocol, it's a standardized grey card system. You can visit their website to look more into that, but your lab must have Photoshop installed and know how to use it, because it's not all labs do this system, but if your lab does it, then fantastic. This is actually what I breed between my clinics. This is my entire photography related shade taking setup. There you got my camera, you got the twin flash with the Sabi diffusers. So I do use diffusers, but not the big fixed light ones. I use Sabi ones, they're a bit more portable. You can disassemble them and pack them in the box. I've got 2 sets of batteries, AA. I've got 3 camera batteries here. I've got the communicator. I've got 3 SD cards, the shade guide, natural dye shade guide. I've got the whole thing. Nothing got here with quadrant photos. This will be a day-to-day. Yeah, your quadrant photos is what you're going to do all the time. You know, you've got a broken tooth, you want to take a photo, or you feel like taking a mid-op photo. Take that photo, you want to crop it, rotate it, make sure it's aligned. Crop it all out, because the eyes don't want to look at anything else. Just crop it and then post it. Same thing here. When you're editing photos, you can use Windows Editor, Mac, or even like your phone editor. I use Lightroom as well when you're taking like thousands of photos, and you can edit that there. That's an online I did, and you can just rest yourself in peace and quiet. This is another example of an anterior injection molding case I did. You can see these zeniths here are a bit off, so we're just going to rotate it so the zeniths are a bit more horizontal, and we just crop it out, and it looks, I know it's hard to tell, but to the observant eye, it's a little horizontal. This was a veneer case that I did. Looks a bit yucky, funky, but with the magic of cropping, you can just highlight the 2 veneers that I wanted to show, and it looks a bit nicer there, and people can share and like your posts. We need the anti-hour social media. There's 2 social media accounts you might be wanting to create. You can have a dental one, or you can have a patient-facing account. A dental one, you can post whatever you want, but patient ones, it's usually before and afters, maybe a day in the life of a dentist. If you start posting about your root canals, and you start posting about like how deep your file went, for the apex, patients don't really care. So it depends on your marketing. So be very aware when you're starting your dental accounts. I've got my logo done here at Photo Logo. for reference there. You can certainly try your own, but I gave up and did it like that. Editing my photos before and after, I just use Canva. It's pretty simple. They've got a background removal tool, and you can use that to overlay your before and after images. Again, marketing. Make sure you abide by RPRA guidelines. You know, these photos are taken 5 months apart, non-emotional languages. One last tip, if you want to take those kind of shiny reflective photos, you can just put on a mirror. That's just a mirror there, and it looks really nice. Yeah, similar thing. This is on a closer mirror. I think we'll end it here. I've got so much more to go, but I think we'll end it there.
Lovely. Thank you so much, James, for that. I think we have a few questions here.
Sure.
Let's see. Got one here. Thoughts on ring versus twin flash?
Well, we've covered this, but ring is my day-to-day, and it's good enough for communicating with patients. I only take out the twin flash for aesthetic cases because it's going to look nice, and I'm planning to put it on social media. I will take out the twin flash, or if I'm doing a posterior case and I'm thinking about putting it on social media and I want it to look really nice and soft, I'll take the twin flash out. But because the tooth's so far back, you have to really increase your flash power, increase your ISO, so the light get into your camera. Because the twin flash is a bit more wider and it's blocked a bit more by the soft tissues.
Nice.
So yeah, have both. Have both. Buy both.
I have another question here regarding flash recommendations.
Flash recommendations. Yeah, let's find that slide here. Essentially, I like the. I've started the slideshow again. Let's. Can you see that? Or I go share it. Let's share the screen. It's 2 seconds here. It's sharing now. If you can see that. I don't really recommend I'm very wary about recommending Godox for the Canon. Recently, there have been some issues for some reason, but I really just would say go for, if you've got a Canon, go for a Canon flash. If you've got Nikon, go for Nikon flash. It's going to cost more, but it will save you troubleshooting if you're having troubles. It will save you a lot of time.
Lovely. Next question here from Hasha9.
Actually, that's a great question, but what if I work rural? I can't just send it to another city. I worked at a clinic once where we had to send all our cases to a Queensland lab, and I'm in Sydney because this group was nationwide, but their lab was in Brisbane. So I can't send my patients to Brisbane. So this is, if you have a lab next door, fantastic. Just send them to the lab, and it's their problem if there's a muck up. Whereas with this particular issue, I had so much trouble. Sometimes I would send it to a lab, and the Kala came back wrong. And there was one time I had to do a try-in 4 times before the patient was happy enough and was sick of it. He's like, whatever, we'll just put the crown in. So absolutely, if you can send the patient to the lab, go and do it. It's much more difficult if it's a single tooth. I would try to use like a more advanced technique like eLab or colorimeter. It just depends what your lab prefers, but yeah, definitely go for a local lab if you can.
Nice, great. I've got another question here. Alternatives for 60mm Canon EFS lens.
There's not much out there. You have to go to 100 millimeters. Go on eBay. You'll always find something on eBay. Every time you go on eBay, there's always one or two Canon EFS lens. If not Australia, there's a UK. Keep looking because I'm going to buy a yeah. Yeah, they're out there. They're out there. Trust me. Yeah, yeah. Otherwise, you have to go. No, I've been looking as well for third-party ones. No third party has done a 60 millimeter 1-to-1 ratio. There's someone else like Tamron, I think they did a 60 mil, but it's a 2-to-1, so it's not as good. It's not as good.
Cool. And another question from the same person: recommended settings for flash for intraoral and extraoral photos.
Yes, we did go through this, but I'll show you the summary. If you can see this. I'll full screen it here. But basically, those are the settings for the f-stop. My shutter speed by default is 1/200. You can do 1/100, but I just set it to 1/200. And by default, my ISO is 1/200. That's by default. But you can certainly tweak that to 1/100 as well. But for me, my default is 1/200 for shutter speed, 1/200 for ISO, and then my f-stop, intraoral, extraoral is as such on those settings. So use that as your guideline, and then you test it out on a DA when you've got some time between patients, and then you will know which one is best for your camera and your lighting and your room size, because these factors play variables in how your photo comes out. But yeah, certainly start for this as a starting point.
Lovely. I've got another great question here.
So if you have a Canon mirrorless camera and a 100mm lens, that's a fantastic start. I think you have heard my recommendation. I love the Canon ring flash. That's my go-to. If I have that ring flash here, that's one here. Yeah, MR14EX2. I want fast. I want fast recycle time. So what recycle time is, when I take a photo, if the photo is a bit off, I do not want to wait for that battery to recharge the flash again. I want to take the photo once and press it again within like a second, so I can quickly get the photos done. So that's what I have chosen. You've already got the 100mm, you've got the body. Get the Canon lens, get the Canon flash. It'll be a great start. You'll love it.
I've also got another great question here. How do you retract for buckle photo shots so you can see the molars?
There's a special retractor called a deep V retractor, and I don't have a photo, but they look like really long V, like this. All right, and you pull the lip with these deep V retractors, and then you see the molar. That's one way. The other way is you put the retractor in on the contralateral side to hold lips away, and I get a buccal mirror or a quadrant mirror, and I stick it in the buccal side of the tooth and take the photo as such. It's actually in the video. If you want me to play the video quickly. I just didn't think anyone was interested, but I'll play the video. We'll do this one. Okay. We'll just find the butt that we'll go to the. So this is at the end with the buckle. You'd rather get a smaller mirror than that, but you can see I placed the mirror not parallel to the molar teeth, but it's almost 45 degrees to the teeth there. And then I've got my camera 90 degrees to the mirror. And I'm going to ask my DA to pull that mirror away from the teeth. I don't want the mirror to touch the teeth. And that's how I get my, there you go. So we move the mirror away there. Then we take the shot there. Sorry, yeah, that's how I do it.
Lovely. Tricky angles.
Yes.
More recommendations here, James.
What's the best diffuser? William, I was on a deep rabbit hole just like you, and I bought the fixed light. Yeah, I've still got it in my storage here somewhere, hanging around. You know, I've got two of them actually, just hanging around here. Don't worry about that. I don't use it anymore. I have actual soft boxes that I bring now. So actually I have two separate stands and I bring them in and I use those for my extra oral photos and my close-up photos. So if you want the best in soft boxes, you want actual big soft boxes. That's what you want. You want those studio style soft boxes. If you want the best ones that sit on a camera, then fixed light is one of the easiest, I would say, because it connects very easily and as in the name, it's a fixed position. So you're not mucking around putting the flashes this way or this way. It's a very, very quick system to use. So I actually like using that when I was using fixed light. So it depends on your scenario. So if you want the best quality photos, go for external soft boxes, which is what I use. Otherwise, if you're doing your intraoral close-ups in the chair, then go for fixed light. There's so much out there, but fixed light seems the most popular. Yeah.
Lovely. I think we'll do two more questions. I've got one here about post-processing software. What do you use?
I use Lightroom. I'll show you my Lightroom software. So when I first started, I used Windows because it was just a free software. But as you start to take lots more photos, so you can see here, I don't know if you can see the screen?
Mm-hmm.
You see on the left here, I've taken and I've kept 10,000 photos here. And each of these photos I kind of catalog. So I can type for this patient, his name is Mick. I'll type the word Mick, and all his photos will show up here as per filter. And I can see what I want to see. Or if I want to see blue rubber dam, which I've used as a tag, I can type blue rubber dam or the word blue, and all these blue photos show up, and I can go through that. You know, for example, there. If I want to crop it quickly, I just do some shortcuts, and I can, you know, do a bit of this, do a bit of that. You got to know your software very well. It took me a while, maybe a week, to learn how to use the software, but it's quite powerful, I feel. But this is a subscription software. This is like, I think, $20 a month. So it's not for the beginner. It's more once you get more serious. But if you want to start off properly, then you can absolutely use Lightroom. Yeah, there's Lightroom Classic and Lightroom, the modern one, which is web-based. So go for the web-based one. I think a lot more people are using that one.
Lovely. And we've got a final question here. Wireless photo export from camera to computer.
You know what? I've been down this rabbit hole as well. There's two ways. The first is your camera sometimes has a wireless function. It can set up a wireless hotspot, and then you have to turn on your laptop Wi-Fi and then connect to the camera. And then, but your laptop has to have the camera software, the Tran driver, to connect to the camera. So that's the annoying part. You have to do this every time you take a new set of photos, which defeats the purpose of saving time. You want to save time because obviously you want to realize I think it's implied that you want to save time, right? This not save time. This adds time to the process. The second option is the Wi-Fi SD cards, which I have also tried. So it's a instead of the Wi-Fi being in the camera, the Wi-Fi is in the SD card. You put the SD card in, it's powered on, and then you have to still connect your Wi-Fi to the card, and you still need the software to access the card, which again defeats the purpose. Yes, that's so tether cables. This is what, I don't know if you've been to I think you've been to the workshop. So you see the demos when I do the workshop, I have a tether cable to the laptop while I take the photos, and the photos appear instantly and are saved instantly onto the computer. So that's probably the fastest way to do that. But the disadvantage is a huge cable. You need a very long cable, like a 3mm cable, so you can walk around. Otherwise, you're going to trip on the cable. But you can do that, but you still need the software opened up. If you get the software open, ready to go, and you want to do that big tether cable, go for it. But to be honest, like when we were doing the demos with Yana here, like when I tried to take the photo while it's tethered, it's not as good. It's not like when I rotate the camera, it's not reflective on the screen, and it's a bit weird. But certainly give it a go. A lot of professional photographers do this style, so tether cables or Wi-Fi cables, but they're not in a rush. They take their time to take a photo. They'll review it on the tethered iPad, move on to the next photo. But in dentistry, we want to get this done quickly. So definitely give it a go. If you find that's really good for your workflow, and absolutely go for it. I'm still testing out myself, but I'm still relying back on the quick photos. Bang, get my SD card out, smash it into the SD card reader and put it in my computer, and then or train your DA if the DA is trained, and they can do that while you are doing notes or talking to the patients. Yeah.
Great.
Hope that's answered your questions. There's no easy question too. I wish there was one answer. I really want things to be really done quickly, but that's the limitation of this technology. Yeah.
Lovely. I think that's all the questions we have for this evening. Was there anything else to add, James?
Thank you, everybody.
Thank you all for tuning in.
If you are interested in, if you end up getting a camera, certainly try and practice. You want to get the ones on the board. And obviously at GDR, we have this as part of our residency. So we spend a day practicing and finessing your camera skills. If you choose to do so, we would love to see you there.
We would. Amazing. Thank you all so much for tuning in tonight. A little reminder, we do have our next webinar August 12th, Predictable Onlays with Dr. Bez. So if we don't see you then, we'll see you then.
See you then, guys. It'll be a good one.
See you then. Bye.
Enjoy your night, everyone. Bye-bye.
Bye.